Hi, my name's Rick Ross and I'm the president of Adventist Health and Rideout, and we're here for the second episode of Rideout Connection. So thank you for joining us today. A little later, I'll introduce our County Public Health Officer, Dr. Fong Liu, and talk to her for a little bit. But first, I want to start with some information and news. As you know, we've been dealing with a significant influx of COVID patients in our hospital. This morning, we had 51 COVID patients with 19 in the ICU. This is certainly a concern that we have. Now, while that's flattened out in the last few days, the positivity rates we're seeing are really concerning, and we can expect to see a further surge here in the next 7 to 10 days. So we continue to look for staff where we can, are looking to build out our resiliency plan, and I really want to thank all of you for what you do both in the community and in our hospital to make such a difference for our patients. You keep coming to work, you keep providing fantastic care, and you show up as leaders in our community. As we know, this round of the pandemic is really a pandemic of the unvaccinated. The surge we're seeing in the hospital is directly related to our low vaccination rates here in Yuba and Sutter County. And that puts a responsibility on all of us. One, to promote vaccination, to get vaccinated ourselves, and we are working with all of our staff to be able to do that. We have a number of pop-up vaccination clinics that we're putting in the hospital at times, and if you haven't been vaccinated yet, make sure you look for those opportunities to get vaccinated. It's the best way you can possibly protect yourself, protect your family, and protect our community. So thank you for your focus and attention to that. I want to express my gratitude for the healthcare workers that inspire me every day in the work that we do here. It's oftentimes challenging. I know there's days we don't know where the extra staff is going to come from, but there's an amazing team of people in this community that just keep showing up and making that difference each day. And I just want to thank all of you for what you do. I had the opportunity today to present 2 awards. I have a President's Outstanding Service Award, and I only have a few of these to give out a year. And just a few minutes ago, I had the opportunity to present this to Tracy Johnson, who is a lab assistant supervisor who has just done an amazing job despite being in that department being short-staffed, continuing to find ways to get blood draws done throughout the hospital, many times coming in, doing it herself, and just really demonstrating what that level of commitment, that level of leadership really looks like. So congratulations, Tracy. The other person is Kathleen Simpson. Kathleen, if you don't know her, is an RN in our emergency department. She is an outstanding example of commitment. Whenever the department's having a bad time, there's Kathleen in the middle of it, doing what she can to provide support for the team and for our patients. This last month, we've seen extraordinary volumes, record numbers in our emergency department. And I want to thank those that work there. And again, I want to congratulate Kathleen on the Outstanding Service Award for 2021. So with that, it's my honor to introduce you to Dr. Fong Liu. Dr. Liu is our County Health Officer for Yuba and Sutter County. Someone who's in the news a lot, but I just am really grateful that you took the time today to come and be with us and talk a little bit about public health and about how we're responding as a community to this pandemic. So first of all, why did you choose public health and why does it matter to you?
Started out as a primary care physician, seeing really sick patients as an internal medicine physician, and I got really frustrated that I felt I was just making one-on-one differences, but not on a population health level. So that's when I said, how can I deliver a population health level of care? That's through public health. And then when I looked at where are the jurisdictions that can actually benefit the most of it? Is it the federal level, the state level, or the local level? and really all the actions at the local level. We can actually make actionable policy decision making in real time based on the current body of evidence and not weighed on a lot of bureaucracy. So that's why I was really committed to this public health career. I love my job, even with all the stress, all the maybe not so welcoming comments, but it combines for me what I always wanted to do. Much is expected of those, much has been given. I've been given a lot of great opportunities, and I want to utilize my skill sets to improve the overall health of Yuba County and Sutter County.
Oh, great. Now, we were just talking a few minutes ago about when we first met, which was February of 2020.
Yeah.
And we were talking about what our vision was to work together for public health improvement in our communities, lots of opportunities to do that. Mm-hmm. And then a month later, COVID hit us hard. And so tell me what that experience has been like for you. Obviously, it's not something any of us really saw coming. But what's it been like for you? And
It's been a humbling experience, and I'm always learning. I'm always having to check and ask am I doing what is best for Yuba County and Sutter County? Are the recommendation I'm putting out in a way that resonates with the community who are not medical providers? So humbling to really communicate complicated medical jargon in a way that resonates and is digestible and understandable for any typical Yuba County or Sutter County resident. And the silver lining, though, is I get to work with you all. And I get to work with all the other medical colleagues. And that siloing of public health and clinical medicine has been broken down. And I don't want that silo to stand back up. I want everybody to conceptualize that hepatitis C patient, it's the same patient who likely will also have a stroke. There's not like a hepatitis C patient who's only public health patient, and there's not going to be that hypertensive patient who's only a clinical ER patient. It's the same patient, right? And how can we continue that ongoing, daily almost communication so that we can deliver the best comprehensive continuity of care for everyone in Yuba County and Sutter County?
So what surprised you most about the response to the pandemic in our community?
It surprised me that people forget that we are each other's friends, we are each other's neighbors, and you want to love your brother. And that you shouldn't even consider this us versus them mentality. You shouldn't have this anger about what's going on. We're all in this together. We're really small. Yuba County has about 80,000, Sutter County has 100,000, combined less than 200,000. We need to work together for what's best for our community and not really fight with each other. And I've been disappointed in that.
Yeah, thank you. So it's been a great partnership, and probably more than anywhere I've seen, the partnership between county public health and the health system. I think the pandemic kind of exposed traditional rifts, but it gave us an opportunity to heal that, put that together, and really puts us in a good position, I think, going forward. So at Adventist Health and Rideout, we've been through a lot, last spring, and you've been there with us each step of the way, daily incident command calls, keeping us informed, helping us respond to the science the best that we can as it's evolving. What do you have to say to our Adventist Health and Rideout physicians and associates about the work that they've done over the last few couple years?
A profound, deep thank you and gratitude. I worry about all of you. It keeps me up at night when I see the daily hospitalized case count. So my public health staff every single day report to me the number of ICU hospitalized cases due to COVID, the number of hospitalized cases overall. They report to me your available beds, your available ICU specific beds. I talk to Gary all the time now. He sends me daily sit reps. I am there with you. Even though you might not know that, on the front lines, but I am there with you. I'm talking to Rick, to Cindy, to Monica, to Gary, to Hank, to Dr. Najjar all the time. And the overwhelming refrain I want you to know is I'm here to be by your side. We are your partner in this, and we will continue to walk with you. You are not alone, and you are my heroes, because I know sometimes I have this inkling, maybe I just show up and work like on the wards. But then I was like, no, I think they would probably need me more as the public health officer, so I stay put.
Yeah. So we're facing hesitancy around vaccination, and in many ways that's why we're seeing such a surge here in Yuba and Sutter County. For those that are on the fence or concerned about the vaccination, how can we address that to help more people in our community get vaccinated?
Yeah, it's okay to have hesitancy. I don't think you're crazy, right? But I want to reassure you that no corners were cut with the clinical trials to develop and authorize the 3 currently authorized vaccines for COVID-19 in the United States, whether it be Pfizer, Moderna, or Johnson & Johnson. Clinical trials phase 1, 2, and 3 were all completed robustly. And the expert panel from the FDA, the expert panel that advises the CDC, they have their due diligence completed for the data review. And then there's a lot of media chatter. There's a lot of misinformation on Facebook, on Twitter. What I would advise you to do is step away from that. Step away from the social media. Step away from Nextdoor. Don't get your information from Google. Get your information from your incident command at Adventist Health and Rideout. Get your information from us in public health. And if you have a question they can't answer, don't worry. They'll elevate it to me. They ping me all the time. And the key thing is vaccination is the only way we're going to get out of this critical mess that we're in. Yes, it doesn't prevent fully infection. We will and will continue to have breakthrough cases, but we're not going to see the overwhelming onslaught of hospitalized cases that we're seeing now. Protection against severe disease, hospitalization, and death due to COVID-19 is still through being fully vaccinated as soon as possible.
Now, one thing I've learned since being here in Yuba Sutter is that we're just not here as a healthcare institution serving a community. Our community is represented in every department, every part of our hospital. And I realized one day I can't go anywhere in this town without seeing somebody who's connected to Rideout through a family member, through their own work experience. And so I realized that, we aren't just serving the community, we are the community. Mm-hmm. And so as we speak to the community at large, and I think as healthcare workers, we want to be influential out there. What would you like to say to the community as we face what's in front of us going forward?
Yeah, and the same thing I just said, vaccination is the key. Please get fully vaccinated, not only to protect yourself against severe disease, but we're finding that we're seeing so many pediatric cases, especially among children younger than age 12 years old, who aren't even eligible to get vaccinated yet. And even within the adolescent age, only 1 out of 4 Yuba County adolescents are fully vaccinated. Only 1 out of 5, on Yuba County side, 1 out of 4 on the Sutter County side. We have this very high risk population within children who need us as adults to protect them. We need to provide that cocoon for these children so that they can safely return to schooling without repeated interruption due to quarantine, due to isolation. It's been a chaotic return to in-person schooling in the past couple of weeks. We don't want that. We want every child to be able to go to school in the classroom, see their friends, see their teachers, but we need you all to get fully vaccinated to protect you.
Well, thank you, Dr. Liu. I so much appreciate you joining us today for our second episode of Rideout Connection. So thank you, everybody, for participating with us. I want to share with you that we're doing a roundtable this next week, and we've asked for anybody who wants to be involved to do that. I wanted to create a forum to kind of listen where you're at, what you're dealing with, and really have a dialogue. These are great for passing information, but I want to create more ways to listen. And so for those of you that are interested, email Linda Plummer and a reason why you want to participate. And I'm hoping to get, as I told her, if I get 2 people, we're going to have a good time. And so please, if you're interested, let us know. We'll be having a number of these, so I want to keep it to about 10 people so that we can really keep it as an engaging conversation. So thank you very much, and have a great week.